placebo. And there was a significant difference between the two groups.
Wow.
This has been shown over and over again in over 50 trials now that you have to use it the right way. One of the jobs I'm trying to do in Finland and also in America is to get this message across to people.
So is it effective against other drugs like narcotics or heroin?
We're moving a little bit on to the edge of the science, but the very beginning studies were with opiates, with heroin, and this also demonstrated you had to use it the right way. The very first trial was a big one that was done by NIDA, the National Institute of Drug Abuse. Back in 1978, a large group of heroin addicts, the doctors who set it up were not thinking of extinction, that you have to shoot up at the same time as taking naltrexone. Instead, they were thinking of drug addiction as a rational behavior. And if you know you're not going to get a pleasure from it, you won't do it. And that was their idea. So they gave the patients a little tag card saying, you have been given naltrexone. Do not use any opiates. If you take a small amount of heroin or methadone, you will feel no pleasure. Don't bother doing it. If you take a large dose, you will die. Now, that's a straight-out lie, but it was meant to scare them so that they wouldn't use it. And what happened was, in the total results, naltrexone was no good whatsoever. There was not a single significant benefit of naltrexone over placebo. But when they looked closer, it was a small subgroup of patients, I think it was 17 in the placebo group and 18 in the naltrexone, or the other way around, that disobeyed the instructions. And they did the right thing. They took opiates, heroin, morphine, methadone, while they were on the naltrexone. And here they got significant results. Typically the ones on naltrexone would try it just a few times and then quit. They had significantly lowered craving at the end of the experiment, significantly lower urine positive for the opiates. And it was concluded in the paper published by NIDA, actually twice, that it works by extinction and you have to use the opiates at the same time. But if you look today at the inserts that are included along with naltrexone, they say, you have been given naltrexone, do not use any opiates. If you take a small dose, you will feel no pleasure. If you take a large dose, you will die or go into a coma. They added the coma onto it, but it's the same instructions that were shown that you have to disobey them 20 years ago. We've lost a generation because of this, because it wasn't communicated properly. Recently, actually, just was reported a Russian group at Pavlov Institute tried using naltrexone the way I was suggesting to, in which essentially you tell the patients, okay, you're not supposed to take heroin, but if you do take it, make sure you always take the naltrexone first. They got very nice results. It worked when you did it that way. There's been a clinical trial in Texas with cocaine and significant results there when it was done the same way as with alcohol.
Cool.
I suspect that it will work with amphetamines, but only animal experiments there. So far, the evidence that I've seen suggests it does not work for smoking. That smoking, you could extinguish it, but probably not with naltrexone. But the story's still out. I'm sure there's other data that is waiting to come out, and I haven't seen yet.
Okay.
There is another whole side to this, though, and that is not only taking of drugs, but doing other things. Like there have been clinical trials showing that it works for compulsive gambling, which is a type of addiction. Every time that you're gambling, you're releasing endorphins, the same as with alcohol. And very nice evidence there.
So how about like online gaming?
Themselves and take your naltrexone before the online gaming. It should work. I mean, I don't see that being any different than going to a casino. As long as there is the same thrill that is releasing endorphins, the treatment should work. As a matter of fact, they're trying to get FDA approval for nalmefene for this right now. It's been approved, naltrexone for alcohol, back in 1995. It hasn't been approved yet for gambling, but I think it's just a matter of time. Hair pulling, sexual disorders, kleptomania. There are case studies for all of these. It's a whole new form of medicine that should be available with this.
Well, but then does it also curb positive habitual behaviors?
Yeah. And this is where you have to be a bit careful in using it. We've developed, in treating alcoholism, a method we call selective extinction. In a Wisconsin clinical trial, there was a report that the people had less interest in sweets. Well, that may not be a bad thing for people like me, but for alcoholics, it's rather nice for them to have sweets that they can go back to. And in the Swedish clinical trial, they found the same thing, and also that it reduced libido, or interest in sex, which you don't want to do. What you want to do is to remove drinking, or whatever behavior has become addictive, but actually build up the other behaviors. What we do in the clinics is to have the patients, when they first start off, make a list of other behaviors that are enjoyable for them. Jogging, cuddling babies, sports, whatever. We tell them, when you're taking the naltrexone, don't do that. And since they're basically interested in drinking alcohol, and we're not telling them they can't do that, this generally goes okay. After they've been in the treatment, it depends upon the individual, 2 weeks, a month, when they can control the drinking for a while, then you have a weekend off. You stop on Friday, you will need to wash the naltrexone out of the system. On Sunday, the patient, they're not taking naltrexone, they're not drinking alcohol, but they do these other behaviors, whichever ones they want. They have the spicy, peppery meal, chocolate, whatever. The patient's report is great. That one thing I didn't mention is when you're taking naltrexone continually, that the brain becomes super sensitive. The number of these opiate receptors increases. And now when the naltrexone is gone and they're free, they're sitting there like flowers ready to be filled. Patients report it's the greatest meal they've had in ages. When we did it in rats, the other behavior was drinking saccharin. And we actually pushed the saccharin drinking up while we extinguished the alcohol drinking. So you want to do it this way, to selectively remove the behaviors that are a problem.
Okay.
I might mention a thing that just recently got into, very theoretical so far, but this was with eating disorders. And this is a case where you definitely have to use it with selective extinction, because you don't want to get rid of eating altogether. You want to just get rid of specific things, like an American eating peanut butter in Finland when the care package comes here.
Okay, why is American eating peanut butter a bad thing?
Well, it depends upon how gravitationally challenged one is. Many people find that there are specific foods that are the reason for their overeating. Or, if I get rid of mayonnaise, that'd be okay, and peanut butter. Other people, it's a particular time, like watching television, or, as one of my daughters suggested, a particular time of the month. If they get rid of the overeating at that time, then there are people who need to not eat particular foods because of dietary problems. In the case of someone who's bulimic, there are particular foods that trigger the bulimic behavior. You don't want to get rid of all eating, but you want to get rid of the eating of ice cream that triggers the bulimia. So you need to alternate back and forth between doing the behavior, the bulimia, with naltrexone, or in this case better with naloxone, and then when it's gone, eating in the proper way.
Okay, so how does this method compare with traditional alcohol treatments?
Our method is cheaper, for one thing, but perhaps most important, it's more attractive to patients. One of the problems in treating alcoholism is that most people who need treatment don't come in. In Finland, it used to be we saw only about 1 out of 10 patients. So 78% success rate, but if you're putting this out of the 9 out of 10 we never see, it hardly shows up. The main thing is if we could get more people coming in who actually need it. So why don't people come in for the traditional treatment? In Finland, I call the traditional way the D method, because everything starts with D. The first thing, they have to detect that you're an alcoholic. You have to admit, you have to wear a scarlet letter A, I am an alcoholic. That's very difficult.
Well, it's like admitting that you're a bad person.
Are in denial. Yeah, well, there is a moral issue that people have thought to this. It's really a disease, but still people see it as a moral issue. And it's very difficult to say, I'm an alcoholic. When we're doing it our way, it can be used for anyone who would like to have more control.